have another amazing episode of Mold Talks Docs. Today I have a very special guest, is Dr. Tania Dempsey. Dr. Tania Dempsey, thank you for taking the time out of your day to be with us here and share your knowledge.
Of course. Thank you for having me.
So I want to dive right into this. And one of the things that I want to ask you about starting off with this is, just to talk about mold in general. Why is mold such a big problem in today's society? How prevalent it is that you may be seeing it? And why do we need to be concerned about this?
Yeah, no, this is a huge issue. And I'm concerned that it's just going to get worse with time. I mean, there's so many layers to this. One is the building practices. I mean, I'm certainly not an expert in how to build a house, or a building, but I know, because I've heard that there are things that we're doing, maybe the insulation we're using, maybe other things that may be impacting and maybe predisposing those buildings to become sick, right? I think there's that. I think in general, people haven't taken mold seriously. I can't tell you how many people think a little water in the basement, a little water, a little black mold on the wall is, can't really be impacting them, right? So there's a lot of misinformation out there. And so I think, obviously there are a lot of people who are being exposed, who are sick and don't know why they're sick, because this is not something that is on the radar for a lot of people. I think what I hope is that with like podcasts like this and education, right, it will get better. But yeah, I think at least in my practice, it's really a major issue for many of my patients. I take care of the sickest of patients, right? They're chronically ill. They have been to every doctor and they don't know what's wrong with them. And I can't say that every single patient is affected by mold, but I would say that a large number of them have mold as a piece of their puzzle of why they're sick. For some of them, it is the trigger that triggered their whole, all their medical problems. It may be a trigger that is, along with other things, making them worse. So you remove that mold layer. For some patients, it's dramatic, in terms of how fast they heal, because that's the thing that's been keeping them sick. For others, it's a piece of the puzzle that if they don't take care of, all the other pieces are not going to fall into place for them.
Right. So, and obviously we're still doing a lot of studies around mold and its health implications. We don't know quite much about if it causes certain conditions or exacerbates them, but certainly it's good to see that when people are taking this as a priority and they're making improvements to their home, we are seeing results in the field as people are being able to be treated and getting better. So that's obviously good news and something we need to look more at, right? Because I think that's one of the big things is people come to you and many other doctors, right, looking for answers. And, they're typically not looking at their environment first. Usually it's last on the list.
Correct. Yeah, absolutely. Yeah. Right. So even in the functional medicine world, right, people are looking at the gut, they're looking at the endocrine system, they're looking at all these different systems internally, right? But we have to always think about, the environment that our body is in and how that impacts all those other things. And the more we focus in on that, I think obviously, the better this will be. Hopefully we'll be able to prevent a lot of illness, right? The more education out there, I think will be helpful. I think that the other piece that I see quite a bit of associated with mold is chemical intolerance. Yeah. Some people know it as multiple chemical sensitivity or chemical intolerance. TILT is another name for it, or toxin-induced loss of tolerance. And, what happens is people, again, they don't realize how their environment has changed how their body reacts to the environment, right? The mast cells are definitely in the mix. The mast cells are reading the environment constantly. And if there's something bad in the environment, they're going to react. They're going to cause a lot of inflammation in the body and that whole host of symptoms that you see down the line from chemical intolerance, but to worse problems, obviously.
Yeah. Yeah, I'm glad you brought up mast cell because, I know that's something that you specialize in, mast cell activation syndrome. Can you give a brief overview of what mast cell activation syndrome is, and what are some of the causes, and also how mold plays a part into someone who may have it?
Yeah, mast cell activation syndrome is really a dysfunction of part of the immune system, and that is the mast cells. The mast cells are white blood cells. And your white blood cells, you have lots of different types of white blood cells in your body, and they have different jobs. They all really are trying to protect you from infections that can assault you, from toxins in the environment. There are lots of things that your immune system has to deal with. And the mast cells in particular are your front line of defense against the environment. And they're situated, everyone has, just to be clear, everyone has mast cells. So these mast cells are there again to protect you, and they're in the skin, and they're in the respiratory tract, they're in the GI tract, they're basically everywhere where there's communication with your environment, again, to protect you. And so the mast cells serve a function. They're if you're exposed to COVID, God forbid, or flu or something, the mast cells will react. If you're exposed to chemicals, if you're exposed to mold toxins, your mast cells will react. And some of that is normal. In MCAS, or mast cell activation syndrome, the issue is that there's dysfunction. The mast cells are already not maybe functioning correctly. Then the person gets exposed to mold, and it just takes it to another level. And even sometimes leaving the mold will calm things down a little bit, but the mast cells are already thinking that there's mold everywhere. And so these patients become really, really intolerant of their environment, of what they put in their body. And it's a multi-system inflammatory condition. And I think that mold plays a huge role in it. So, the way I look at it is, it's sort of chicken or the egg. Okay. So which came first? So for many of these patients, they had an underlying immune dysfunction. Then they got exposed to mold. Maybe they were exposed to a tick-borne infection like Lyme disease. Maybe they had Epstein-Barr virus. They had something there. They've been exposed, and these different assaults on their mast cells, on their immune systems, have sort of heightened them. And over time, they get worse. So mold is a major trigger that can definitely make them worse. There's certainly a subset of patients who were fine. They did not have any dysfunction of their mast cells previously, but then they live in this moldy environment for weeks, months, years, and over time, their mast cells become more dysfunctional. And in those cases, we call that secondary mast cell activation syndrome. What you hope is that by removing them from the moldy place, that their immune system will reset. And sometimes it does, and sometimes it doesn't. So that's the problem, right? Because I'm an optimist. I like to think there's a lot we can do to help people. You take them out of the moldy environment, you detox. There's all these things that we do. We calm down their mast cells. We help them heal. But the reality is that mold is so toxic. And we're talking about mycotoxins. The mold itself is problematic for other reasons, not just the toxins. And for some patients, unfortunately, I think it does sort of reset them in a negative way, where their immune system just over time is more, responsive, reactive. And my job is to get them to be more tolerant of the environment. That's tough, right? But I think mold is so important that we have to understand that some of it may be irreversible if we don't get it soon enough.
No, it's a very valid point. Thank you for kind of highlighting that. It's interesting, and obviously, when we talk about symptoms, right? Everybody experiences different symptoms. There's different levels of sensitivities. I've seen some interesting things over my career as far as people with light sensitivity, sound sensitivity, chemical sensitivity, EMF sensitivity, right? So the list goes on, and it's different from person to person. We've also seen with COVID, this person had more of a serious illness. This person lost their sense of taste and smell. The other person didn't. So we're kind of learning that all of these things impact us individually and not necessarily as a group. What are some of the telltale symptoms of mast cell activation syndrome? For those listening, maybe it'll help pinpoint them and cue them into taking a look.
Yeah. And I'm glad you made a good point. Before I go into that, I just wanted to say that that, one of our hypotheses is that there must be underlying mast cell dysfunction in patients who wind up with complications from COVID, whether it be the loss of sense of smell, whether it be the long haul COVID. There's probably that predisposition. There's probably already dysfunction in their mast cells. And again, that can translate also to the exposure to mold and everything else. The symptoms, this is a multi-system disorder, syndrome. So it can affect many different, at least 2 systems in the body, but it could be more. And, starting with the skin, some of these patients have a lot of skin manifestations. It could be things like eczema or psoriasis, or they're just more, their skin is more sensitive to the sun or to other things, right? So the skin is a place where there's a lot of mast cells. The respiratory tract, some patients have allergic-like symptoms. You don't need to have allergic-like symptoms to have this mast cell issue, but you can. And allergy is certainly on the spectrum of mast cell issues. So some people have the respiratory issues. There's tons of mast cells in the sinuses and the mouth and in the lungs. And so, there could be asthma, there could be shortness of breath. Some of the symptoms are subtle, In the GI tract, a lot of patients have issues with their gut in terms of their tolerance to food. So some of these patients become less tolerant. And over time, they might have only a handful of foods or less that their body doesn't react to. They can have nausea, bloating, diarrhea, constipation. They can have small intestinal bacterial overgrowth. They can have just like their microbes in their gut. The microbiome can be out of whack. And so the GI tract also tons of mast cells and tons of way it can manifest. It can be inflammation like colitis and other things. In the nervous system, it's really interesting because there are a ton of mast cells in the nervous system and in the brain. And so we see a lot of neuropsychiatric symptoms that could be anxiety, depression, OCD. It could be a variety of different things in that realm. Neurologically, neuropathies, different types of neurologic conditions could potentially be linked. There's some studies looking at things like Parkinson's disease may be linked to this, and even Alzheimer's and autism. I just like ran through a lot of different systems. There are other things that can cause endocrine issues, joint issues, muscle issues, connective tissue issues. You don't have to have all of them, obviously. Migraines, I will mention, big symptom. Like the things that I think about that are kind of common that might be associated with MCAS, or I would say definitely associated with MCAS: migraines, fibromyalgia, interstitial cystitis. They're just some buzzwords that or conditions that we kind of are starting to understand that they're linked to mast cell. And just to be clear, right, mold, if you think about what mold can do, right, a lot of mold patients have those symptoms, many of those symptoms, right? Yeah. And the question is why? And I would argue that it's because the symptomatology is actually coming through the mast cells and how the mast cells are reacting.
Well, that makes a lot of sense. And that was a wealth of information. Thank you so much for that. One of the other things that I've heard recently is inhalational Alzheimer's and neurodegenerative brain disorders as a result of too much exposure inside of a water damaged building and other underlying conditions. There's certainly a lot more studies that need to be done. We also don't know how much it impacts people who are known as otherwise healthy. I can tell you from my personal experience, my health definitely declined over the past 10 years. Even with protection, it's never 100%. You're always going to have, some accumulative exposure. I was in this weird phase where I wasn't losing weight. I was gaining weight regardless of my diet. I mean, I was eating like a chipmunk and eating the rainbow and everything in between, cutting out sugar and carbs. Nothing was doing it. And then all of a sudden I started utilizing a sauna. I started detoxing. What was interesting about the sauna too, and you may have some comment on this, is it actually took me 7 days in the sauna before I started really sweating. It was like dribs and drabs for 7 days. 7 days later, I started sweating like a faucet again, which is more normal when you're sitting in a 140-degree sauna. So I found that very interesting and unique. But it just goes to show that I personally don't understand, how it can't impact people that are otherwise known as healthy, because even though we may have a different toxic load tolerance, I would imagine we're still exposing ourselves to toxins. Probably not a great idea.
Oh, absolutely. But then there's also these other things that we're exposed to. So it becomes like this really interconnected thing in our bodies, right? So it's old infections, it's other toxins, then you add the mold and the mycotoxins, then you add, inflammation from other things and exposures. And so, yeah, it becomes really a vicious sort of cycle of things. You try to fix one thing and then you wind up dealing with something else. But yeah, I would say, I mean, it's interesting that's your experience with your weight. I think that's a really common symptom
Yeah.
that I see in my patients, patients who I know are really strict with what they're eating, they're exercising, they're trying to do everything, and they just can't lose weight and they just keep gaining weight. And to me, that means that there's a metabolic dysfunction. And it's stemming from mast cells for sure, by the way. I'm not going to tell you have MCAS, but you might.
Yeah, it's very
I'm
possible.
trying to diagnose you. But the truth is that the mast cells are definitely involved in metabolism and insulin resistance. And so I think that, again, some of that symptomatology is coming from the mast cell, but I see Lyme disease, Bartonella, Babesia causing weight gain like that. I certainly see mold and mycotoxin causing weight gain like that. And so, yeah, that's a symptom that if people, are not sure what's going on and they don't know if they're being exposed to mold or whatever, right? That's a
Yeah.
good starting place. Like something's wrong. You got to start, looking at all the possibilities.
I totally love the idea of raising the awareness to the point where people are looking at their environment more, and helping to avoid some of these conditions. Because for some people, as you said, sometimes they get so bad that it's almost impossible to reverse it. Right. So if we can be more proactive as a society and be more mindful of our environment and the impact that it can have on us, I think that's going to put us in the right direction. Let's talk about some, the avoidance of mold, whether it's moving, cleaning, remediating, all the different things that people do. You've mentioned earlier that you're seeing remarkable results when people do get out of the exposure. And so anything else left to comment on that before we kind of pivot to some of the failed remediation and kind of explore that together?
Yeah. Yeah. Um, I think that the hardest thing really is trying to figure out what to do with the house that people are living in. Listen, water damaged buildings could be offices that people are
Yeah,
working in too. But if we're just going to talk about the home, right? Narrow it down to that, I think it's hard, right? There are financial constraints, there are family constraints. Not everyone can really just like pick up and leave. And even if you pick up and leave, you still have that possibility that you're going to be exposed to mold in another place, right? So that's the challenge. The patients who can sort of guarantee that the place that they're going to is mold free, they've tested it maybe, or they know they feel better in that environment, right? That's where it's helpful. And yeah, it's an important piece, but it's sometimes very hard on an individual
sure.
level to figure out what's going to be right.
Totally. So a lot of people are turning to remediation as part of their journey back to wellness. And obviously for the patients that I help, we're seeing remarkable results. People seem to be doing well. They're getting better. They're really happy with what they're doing. But then there's people that are not, right? And the people that kind of try different strategies. And you mentioned it earlier, there's financial constraints, right? Financial constraints are going to make people turn to solutions that sound good, in theory, but maybe not as effective. And also, of course, family constraints. There's family that disagrees on how important of a role it really plays into their health. And so if you're not, bought into the process of remediation, that whole family constraint can make things difficult. We see that all the time. One of the biggest misconceptions about remediation is just how in which to remediate. Uh, Many people that are listening to this kind of know that I preach removal is really the key. You want to locate the source, remove the particles and toxins created by those sources. We see that process has worked over the last 10 years. It continues to work. There is a lot of strategies now that are more cost effective, such as fogging. And I mean fogging not as part of a remediation process, but as the process where they're talking about demolition-free remediation. You don't need to remove any building materials. We're going to use pure acetic acid or other components to just totally obliterate mold. Scientifically, that doesn't hold up. We've seen the white papers regarding these products. We've seen the studies. You got a U-shaped recovery and not a good one. With that being said, what is your understanding with fogging and some of these other non-traditional methods? Have you seen any success, through your practice? Anything you can care to comment on in that regard?
Yeah, listen, I think the biggest issue is financial. And, patients, my patients at least, often interview a few different remediators. And, they make, they may feel confident in whatever everyone is saying, maybe different things, right?
Sure.
But the fogging thing, I'll just say, it sounds kind of exciting. It's definitely cheaper. It, kind of solves the problem of you don't need to move. You don't need to worry about construction going on in your home. There's a lot of reasons why that sounds so good, right? But the source of the mold is always going to be there. And that U-shaped curve you mentioned, right? It's because, yeah, you'll get better initially because you'll kind of clean out some of the mycotoxins and sort of the surface stuff that people are reacting to, but the source is deep inside and people don't get better. And one of the things that, I feel bad, it really breaks my heart when I'm dealing with patients where they seem to get better after an initial remediation and then they not better. And we do testing and we determine that they still have a mycotoxin issue in the home and they're devastated. They just spent all this money and they've done it like, halfway basically, they found a remediator who's going to save them money and they're going to focus on certain parts of the home, but they're not going to do the whole thing, or they're just going to fog the home, which again is not getting to the source. But some of them are trying to get to the source. They're told that there's mold behind a wall, right? So they have the remediators remove that. But they're not paying attention to the rest of the home or the HVAC systems or something else that's affecting them, and they're not better. And I have to tell them, it's like, it breaks my heart when I have to tell them like, oh, you spent all this money, but now you might need another remediator to come in and take a look and try to figure out how to deal with that. Listen, I don't talk about my personal experience a lot, but I definitely, we had an issue with mold in my home. And we went through 3 different remediators. The first one halfway, the second one fogging, the third way, and not giving you a plug, but obviously it was your company that helped us. And yeah, there's a vast difference with that approach and how you do it. So I've lived it firsthand. I've lived it with my patients.
Yeah.
And, it's sort of like, it's better to pay the money up front. It seems like a lot. And I'm not plugging it in any way, but I just think you have to look, it has to be a comprehensive approach. It's sort of the way I do things with patients.
Yeah.
I can't try to fix their thyroid gland if they're really, exposed to mycotoxins or they have Lyme disease. I can do all that, until I'm blue in the face, but if I don't get to the root cause, right? It's the same thing with the house. If you don't get to the root cause, you're just going to keep dealing with this for years and you're going to continue to be sick and you're going to continue to spend money trying to figure it out when, you maybe pay a little more in the upfront, but it's, everyone has their challenges. I know that. And so, I just wish that the industry for remediation was a little bit more uniform. There's just so many different opinions. It's like that in medicine, unfortunately, too. I get it. But it would be better, right, if there was some kind of way for the remediators to sort of all kind of understand what they have to accomplish. And they don't always. A lot of them don't understand the mycotoxin issue. They don't understand, that it's just not, air testing that's going to, to base their decision making on.
Yeah, the standards unfortunately are not so standardized. That's one of the biggest challenges. And it's not just remediation. You brought up a good point, testing too. Right. And so, as we've all heard these horror stories. Somebody comes in, they do an air test in the center of the room and they say there's no mold issue there. You're looking at the labs as a doctor and you're saying, no, you're definitely exposed to mold. Right. And then all of a sudden they hire somebody else for a second opinion that finds all these issues. It's really difficult because it's already an expensive journey. And for people to waste money and get bad advice or bad opinions just makes it 10 times more difficult. And we're seeing that time and time again across the country and even across the world. I speak to people in different parts of the world and they have, it's worse than here. They have basically nobody that understands, how to identify where sources of mold are, how to remove them properly. And there's just a lot of work that's really needed. I think we're kind of at the infancy still of where we need to be versus where we are today. But I've seen some really positive changes over the last decade. I'm sure you have too. And I think we just need to keep it going. And it's people like you that are helping people and are doing the right thing and guiding them. That's really helping push this forward because, people go from doctor to doctor, doctor to doctor, 40, 50 different doctors in some cases before they finally find someone like you who is actually looking at different biomarkers and is saying, hey, I suspect mold or bacteria is at play here from a water damaged building. Let's actually talk a little bit about bacteria. Have you seen any bacterial issues within water damaged homes that are translating to the health side as well?
Oh yeah, no, absolutely. I mean, some companies, some testing companies are starting to look at and measure those bacteria. Yeah, I think that if you're focusing on mold, there are lots of great doctors out there who are detoxing people from mold or whatever. But right, there's a little more to the story, because yes, there are also these bacteria that can have different effects on the mast cells and also the rest of the immune system. And then there's often other things there too, besides what's in the environment. From a microbial perspective, there's the microbes inside the body that I
Yeah.
know sounds crazy, but like kind of communicate with what's going on the outside. So yeah, I think it's a big issue, but I don't think there's a lot known about it. I think this is like a more like an emerging area.
Yeah.
I'm blanking on the name of the bacteria. Can you remind me on?
It's actinomycetes.
Yeah, right.
Yeah. Yeah. And what's interesting about it is if you look at the studies, all the actinomycetes samples are typically collected in the drain lines, like the HVAC condensation line. And so it is very interesting. What we do know is that there are certain actinobacteria that actually come in the same sources where the mold is growing. So that water intrusion is what allows for the actinobacteria to thrive and for the mold to thrive. So the nice thing about this is if you are focusing on the mold, which is a lot easier to detect right now, you likely will kill two birds with one stone there. So for those who are concerned about actinomycetes, maybe listening, they're following kind of more of this guided mold process. You'll be able to remove bacteria. And that's also true of the fine particle cleaning that many people know about. In that fine particle cleaning, if you're using a broad spectrum disinfectant like Benefact, you're using microfiber towels as an example, you'll be removing some of these particles as well and reducing the bacterial load too. So the nice thing about it is it's all new science that's emerging. The jury's still out on how big of an issue it is and, being able to identify the sources of it, because the actinomycetes test is kind of like the ERMI for bacteria. It tells you all the different DNA of what's there, but it doesn't tell you where it's coming from. The good news is it's typically coming from either your drain lines or where the actual water damage sources are. So for those listening who are, looking for information about that, that'll be how you handle that. I guess, but before we go here today, I definitely wanted to open the floor to you and ask if there's anything else with regards to mold exposure, water damage buildings, how it's impacting their health, and any other fun tips that you can give to help identify that or make
Mhm.
sure that they're on that path to wellness.
So one thing I wanted to add is that a lot of times people will get these reports. They do suspect something, they have some testing done, and they don't find a lot of mold. And maybe even a repeat test will show that too. But really, the problem is not just the mold; it's the mycotoxins, maybe the bacteria as well. But I have patients who actually don't have, like, their ERMI is not off the charts. There are just some things that are not that bad, but the mycotoxins that are produced, so not a lot of mold, right, are necessary to produce a lot of mycotoxin. Mycotoxin is really sticky, right? It sticks to like everything,
Yeah.
and is neurotoxic. Some of them are neurotoxic. Some of them affect the metabolism. Some of them are hormone disruptors, and lots of other things.
Carcinogenic too.
Yes, yeah, absolutely, absolutely. So I just think that that's an area that I think we need more research on. I think we have pretty good testing right now. I think it needs to be even better. And I think the inspectors who go into the home, like I'm thinking about it, but I'm telling the patients to go get inspections done, and they're not, the people testing are not thinking about it. They're just testing for mold, and they say, well, you have a little aspergillus, or you have a little bit of cladosporium or whatever. Oh, don't worry about it. And then you do mycotoxin testing, and actually there's something like trichothecene, and trichothecene is really produced by a particular class of mold, more of the, we'll call it black mold. Stachybotrys. Exactly. And so you think, okay, you have the mycotoxin, the mold testing didn't pick it up because there's air testing, and the stachy's like in the wall, right?
Yeah.
And so I just think that, I just wish, right, there's more uniformity in terms of testing and remediation. But I think this is why you do podcasts like this, because you educate people. And hopefully they start to think, oh, maybe this is a problem. Maybe I have to find someone who is doing, mycotoxin testing of the home and matching it to the mycotoxin testing we do on them. So we'll do a urine test and we'll measure mycotoxins. And I can't tell you how many times we can match
correlation.
With what's going on in them. And so again, that's confirmation. So some people will say, well, how do I know it's my house? I spend, 8 hours a day in my office. Could it be the office? Sure, it could be. But if you test the mycotoxins in the home and you do yours and it matches, or it doesn't match, right, then maybe you think there's something else going on and your exposure is also elsewhere. So I think that's an important point that I wanted to make.
Yeah, I have a new product coming out that I'm not going to plug here because that's not what this is about. But I want to talk to you a little bit about the theory of it and see what you think.
Okay.
So for many people, they kind of go on this journey where they're getting testing done by an inspector as their first stop. And that's kind of validating if they do or don't have an issue. And that's all dependent on how good the inspector is at helping locate the issue. What if we took a step back and started by analyzing their dust? What if we did mycotoxin, endotoxin, bacteria tests on their dust? Because if there's something in their environment, it's typically creating these particles that you can then pick up inside their dust. And then you can take that to the inspector and say, hey, it looks like I have Stachybotrys, Chaetomium, and high levels of Aspergillus here. Can you help me find it?
Interesting.
Instead of getting the all clear from the inspector, now they're taking this data ahead of time and saying, I better find where these sources are coming from. And so my idea is to kind of change the way we look at this and to revamp the process, to make it more standard, to really find these problems.
And then I think that's an interesting point. And I think it puts the sort of the responsibility on the person, the patient that's dealing with this. And that can be good or bad, but in some ways, right, a lot of patients, they're handing over their life to first the inspector and then the remediator, right? Because they don't know enough about it. They don't know how the testing is done, right? So maybe in this way, they take on the testing so they can trust maybe themselves to do what they need to do to get the answers. And then you hire the inspector to help, right? That's what you're sort of saying. Then you hire somebody to help you figure it out. That's interesting. And maybe that helps the inspectors get better at what they're doing.
I think it's could be something, if it works, I think it's going to work big, because I think it'll really help. It puts the client back in the driver's seat. Yeah. This is what I have. I did the sample. I know for sure this is what I have, and I need your help to find it. Instead of having somebody say, is there an issue? And you have you're relying on somebody taking maybe air testing to identify if there's an issue that could potentially miss things. I think starting with the dust, because what happens now, even when you have a really good inspector, they're analyzing the dust, they're doing more of this progressive testing. By the time the results come back a few weeks later, they're already long gone on to the next client. And so if they, for some reason, missed a source, that could get lost in translation, where if you have the data first, you'd be able to really identify that.
Now, there are some tests, home tests, that are available already. So what's the difference between what we have that some of my patients have used on their own? You can buy an ERMI kit and do it on your own. So what's the difference?
Well, the difference for us is going to be, they're going to all come together in one easy thing. And it's going to be more affordable because they're bundled together directly from the labs. And it also is going to come with a consultation to discuss what we're seeing based upon the results and help outline a plan for what you need to ask the inspector for next. So it's kind of it puts you in the driver's seat, but it also comes with a little bit of education. so that you can be sure that when you're getting the inspector there, you know exactly what to say to them. And it'll help you vet the inspectors from that point too. So that'll be the main difference, bundled together, cheaper pricing, and a little bit more of a guided experience.
Sounds sounds great. I think, again, if that helps the industry, and it may help in a lot of ways. You can run studies on it. You can see,
Yep.
what the correlation between that is and what the inspectors find. Maybe it educates the inspectors. Maybe it educates the remediators. Again, there has to be a better way to do this. I feel like there are people out there taking advantage of patients in ways that, it's really, really unfortunate. And then there's the good guys out there trying to do their job, but they're not, getting the credit because there's so many other people who are sort of discounting them. So
That's true.
it's a tough industry.
It is. You're right about that. So kicking gears back to more of the health side of things, if someone knows they have mast cell activation syndrome, or someone knows that they're being exposed to mold and they're making the steps towards remediating or getting out of it, et cetera, what are some things they can do to begin treatments? What are some of the treatments that your clinic offers? And, are you currently seeing patients? Where could people go to you if they're in need of your services, et cetera?
Okay, so my approach, so I just want to sort of mention, I'm casting a pretty wide net. I'm really trying to look at all the things that I know that could potentially be impacting the patient, take a very, very thorough history, and then, do a lot of testing to really understand, not unnecessary testing, but testing that would help me sort of put the pieces together. And if I feel like the story is good for potentially a mold situation, listen, some patients grow up with mold, and they're actually not living in mold now, but they're sick from the past, and that's an issue that we have to figure out. Or they're living in mold, and we have to sort of walk them through how we do that. I mean, what I have found to be the most helpful is actually working on their immune system while they're trying to figure out their house situation. Because if I can it's really quite remarkable what I have found. Sometimes I'll treat the underlying mast cell activation syndrome. So if I know their mast cells have become so dysfunctional that it doesn't even matter what's in the air, right? There's always people that, they live with other family members who are fine, presumably, but they're the ones that are really sick. And so if I can prove that really MCAS is the root, and I can start treating them, sometimes it's simple stuff. Sometimes it's vitamin D or some kind of supplement, or sometimes it's antihistamines. And there are a lot of other things and interventions that we can use for MCAS. What's interesting is for some of them can then tolerate the world a little better. It hasn't detoxed them from the mold or anything, but they can tolerate what's around them, right? A lot of the goal is we live in a pretty toxic world. I hate to say it. I hate to be so negative. It's pretty toxic on many levels, right? From plastics to pesticides to GMOs, all this stuff, right? So we're never going to be able to control all of it. I mean, I'd like to think that we're working on it, right, as a country, world, or whatever, but let's just say we can't control it, right? We know that our bodies can't deal with a lot of that, or a lot of people can't deal with it. So some of what we're doing is trying to get our bodies to become more tolerant of the world that we live in. And so some of that comes from working on the mast cells and trying to get them to calm down a little bit, be less reactive. And then you can kind of work on the rest of the stuff. I can't detox people. I can't deal with their mold if they're so reactive, and they're going to react to the things that I'm trying to give them to fix the problem. So for me, it's always like we start there. We start to sort of, I always use this analogy of the onion. We're peeling the layers of the onion. And for some patients, I don't even have to detox them. It's really incredible. I know there are a lot of people out there who are doing these detox protocols. They talk about the SIRS and all that. I don't want to say I don't buy it, but a lot of it is really is grounded in the mast cell, actually. And for some patients, removing them from the source, helping their immune system work better, helping their body work better, sort of all the organs working together. I don't really have to, quote unquote, detox them. I don't necessarily have to put them on cholestyramine or anything else. I mean, I know that some patients may need that. I know that that's what other doctors do. But in my practice, I have found, really tremendous success at sort of like working on all the pieces. And sometimes the body can then just kick in and do what it needs to do.
Yeah.
So that's sort of how I look at it, but everything is individualized and every patient will require a different approach. But the mast cell piece is really huge. At least again, in my practice. Just to give you information, I have my own website is Dr. Tania, drtaniadempsey.com. My office is Ames Center for Personalized Medicine. We're in Purchase, New York, and Westchester. The website is AIM Center, PM, P as in Peter, M as in Mary.com. And then, of course, Facebook, Dr. Tania Dempsey, and Instagram, Dr. Tania Dempsey, MD. And I do a lot of podcasts and educate and speak, and I like to and write, and I like to get the information out there because I think, again, like what you're doing, what you're thinking about for patients being able to test or people being able to test, the same for me. I think it's about patients need to be be educated and advocate for themselves because there are too many people around who are not, listening to them or taking them seriously.
No, and I love the way everything's headed, as far as science and medicine being data driven. Data is really what helps us make decisions. And without that data, putting people on treatment protocols or just detox protocols without knowing what their experiencing is, you could have these severe reactions like we've heard in the past. I really appreciate all that you do and everything that you're doing. And, I'm super inspired by you. I've had the pleasure of knowing you for many years now. I just hope that everybody who's listening learned a lot. One last question for you, Dr. Dempsey, and that is, if you had to only give one piece of advice to those listening, maybe it's someone who's going through a mold journey, someone who's going through mast cell activation syndrome, what would that piece of advice be?
So, I think that it goes back to advocating for yourself and insisting that people listen to you, that other, practitioners, medical practitioners listen to you. I think the thing that I see all the time is that people are just not taken seriously. They know that there's a problem. They just need help finding the problem. And so, and that's why this education piece is so important, right? I think that's really the take home message is look, there's a lot of things that people should be doing, right? We should be thinking about not drinking from plastic bottles, and we should think about not microwaving in plastics. And there's so many things. I mean, the list can go on. I could speak another hour about that or more. So I want patients to do all that. But I think at the end of the day, it's about finding the person, the medical practitioner who they can connect with, they can trust, and that medical practitioner understands that the patient is trying to get a point across, is trying to express their problems, their concerns. We have to listen to them. And so that's always like my thing. Like we have to trust the patients who are coming to us because they know their body better than us and they have to advocate for themselves. And it's unfortunate that they're in that situation. I wish that, wasn't the case, but that's always that's my take home. I think really at the end of the day, try to get the answers, try to find ways to figure this out, because it's just going to be better for you in the long run. My dog is not upset.
It's okay. No, I really appreciate it. Thank you so much. This was so informative. I hope everyone learned a great bit with having you here today. Thank you so much and hope to see you again soon.
Thanks so much. Thanks for having me.